everyone. My name is Dr. Carolyn Oldham, and I work at the Southeast Center for Agricultural Health and Injury Prevention, as well as the Central Appalachian Regional Educational and Research Center at the University of Kentucky. So today I would like to share with you the preliminary findings of our agricultural community willingness to intervene research. And this research is basically, we've been engaging in this due to our efforts at the state level to help address the mental health crisis we find our farming communities facing at the state, but this is also occurring nationally, as we all know. So as of 2017, 3.4 million farmers were working in the United States, and agriculture is one of the industries with the highest percentage of deaths by suicide. Key factors that contribute to these rates include financial losses, chronic illness or pain, a sense of work-life imbalance, and are the physical and social barriers to accessing mental health services. In 2018, SAMHSA reported that 60 to 80% of visits to healthcare providers in the US are related to stress, and that nearly 20% of these individuals that account for that 60 to 80% of visits reside in rural areas. So even if a farmer, for example, attempts to seek care, they generally reside in rural areas, which comprise 85% of the nearly 1,700 federally designated mental health professional shortage areas. So therefore, farmers who may be of the greatest need of any occupational group are going without crucial mental health services. So suicide really is a community problem, which must be addressed using a community approach. Dr. Julie Searle out of University of Kentucky, her research finds that for each suicide, 125 people are impacted. And we know that there's kind of a spectrum of being exposed to actually engaging in short-term and long-term levels of bereavement as a survivor of suicide loss. And we know that these individuals who are survivors of suicide loss are at a greater risk for mental health, mental illness and suicide. So to develop communities of practice equipped with addressing mental health within agricultural communities, the Southeast Center for Agricultural Health and Injury Prevention began training 17 individuals in QPR gatekeeper training with the support of an AgriSafe grant funded by the USDA. So what is QPR? Well, QPR refers to question, persuade, and refer, and it's a gatekeeper training for suicide prevention. It's a 1 to 2 hour educational program designed to teach lay and professional individuals alike the warning signs of suicide crisis and how to respond. The process follows 3 steps. First, question the individual's desire or intent regarding suicide. 2, persuade the person to seek and accept help. And then 3, refer the person to appropriate resources. QPR has been cited by several research studies to improve knowledge, attitudes, and self-efficacy to intervene across populations. Agricultural community QPR for farmers and farm families is something that we then developed at SCAHEP, the Southeast Center, which pairs QPR training, which was developed by Dr. Paul Quinnett, with an introduction to the agricultural community stressors, as well as discussion of barriers and specific cues that we should be using to prompt mental health care seeking behaviors among farmers and farm families in rural communities. So training was developed by the QPR core research team, so individuals from a variety of institutions of higher education here in Kentucky. And it addressed how questioning, persuading, and referring might best be facilitated within the agricultural community. So the objectives of our training, Agricultural Community QPR for Farmers and Farm Families, is to provide information on the unique challenges a farmer or farm family member faced that can lead to stress, depression, and suicide. Secondly, to provide examples of how to implement each QPR component with a farmer or farm family member at risk for suicide. And third, to provide information on what you can do to help a farmer, you or the individual being trained, can do to help a farmer or farm family member at risk of suicide. So at the close of this grant in March, we had trained 17 trainers. And those individuals went out and then trained 415 individuals from a wide variety of stakeholder groups. So we had individuals that were trainers, that were responders, that went off into their community of responders and trained others, educators, individuals in farm commodity groups, the ministerium, and so on. And so 278 Kentuckians were trained in local agricultural community QPR for farmers and farm families. And you can see that we mapped out looking at the counties where we had the greatest breadth of reach. And then in addition to that 278, we also gave a national training with AgriSafe. It was hosted online. And we trained 137 individuals across the nation. So prior to and 1 month after training, we administered the Willingness to Intervene questionnaire, which has been used for other gatekeeper programs to kind of evaluate the impact of the training. We also used it to assess participants' attitudes, subjective norms, perceived behavioral control, and intention to intervene with a suicidal individual. So there were 4 scales within the instrument. Attitudes address the respondents' attitudes and beliefs about intervening when someone is suicidal. So responses are measured using semantic differentials with the stem intervening when someone is suicidal would be. And then some examples of adjective responses would be beneficial to harmful, and then they could kind of choose within that scale sliding what their choice would be. And then stressful to not stressful. So those are 2 examples of attitudinal items. Subjective norms measured respondents' attitudes about how other people would feel about them intervening with someone who is suicidal. So it uses a Likert scale of strongly disagree to strongly agree. And examples of some of the items included, most people who are important to me approve of me talking to someone who may be suicidal. And again, they would either strongly agree all the way to strongly disagree, or I feel social pressure to intervene when someone is suicidal. The 3rd scale was perceived behavioral control, which addresses the respondent's perceived ability to intervene when someone is suicidal. Perceived behavioral control also employed a Likert scale responses of strongly agree to strongly disagree, and was measured with such items as it would be too difficult to talk about suicide when someone is suicidal, or I believe I have the ability to intervene with a suicidal individual, or it is difficult for me to discuss my concern for someone who is suicidal. And lastly, the scale of intention. This scale addresses the respondent's intent to intervene when someone who is suicidal, to intervene. So their intent to intervene with someone who is suicidal, or the likelihood that they would engage in behaviors such as seek help for the suicidal person or do nothing at all. So to this instrument, we then added demographic questions such as occupational industry, race, ethnicity, gender, whether they work or have worked on a farm, whether they live or have lived on a farm, and other variables. So, and then to meet the assumptions of chi-square analysis, to meet the assumptions of chi-square, what we did was collapse the 5-point scales into 3-point scales. So I began looking at the data through the lens of really looking at the differences between respondents' groups' responses to the items. Looking at that through the lens of using respondents' demographics. So what we noticed the most statistically significant differences in was the scale of perceived behavioral control. Comparing demographic groups, those that were in ag industry versus those that don't work within the industry of agriculture, that employment demographic variable showed the largest statistical significance, particularly in regard to perceived behavioral control. So you'll see here on the slide that respondents employed within the ag industry were less likely than those in other industries to believe that they were quite knowledgeable about suicide prevention, that they are comfortable using community resources related to suicide prevention, that they are knowledgeable about community resources related to suicide prevention, and that they have the interpersonal skills necessary to discuss the presence of suicidal thoughts and feelings with a suicidal individual, and that they feel confident in their ability to help a suicidal person. Now, this is all of the data that we collected from the Willingness to Intervene instrument prior to training is what I'm presenting on today. So we see kind of a baseline of where these individuals that work within agricultural industries are in terms of perceived behavioral control as it relates to intervening with a suicidal individual. Other statistically significant differences among respondent demographic groups included so in terms of perceived behavioral control, respondents who live on a farm or have lived on a farm were more likely to believe than those who have not lived on a farm that it is difficult to discuss their concern for someone who is suicidal. Respondents 55 years and older were more likely to believe than those younger than them that they have the skills necessary to clearly convey their concern for the suicidal individual. And female respondents were more likely to believe than male respondents that they have access to suicide intervention resources. The only statistically significant difference between respondent groups on the intention scale was that respondents employed within the agricultural industry were less likely to ask the individual if he or she is suicidal. So overall, 65% of respondents stated they were likely to engage in this conversation. So with this data, the data that we currently have, as I mentioned, is on pre-training willingness to intervene measures. We have collected the post data now that we've closed out our grant and our training cycle. We are now looking to train an additional 40 trainers underneath a new statewide effort and funding that's come down. And so what we did was we took this preliminary data, and what we decided to do is to revise the training for this next group of 40 QPR gatekeepers to focus on the identified needs, kind of looking at specifically additional referral information. That's been an area where individuals feel like they're not equipped. We also provided an enhanced orientation to resources. And really interestingly, with the pandemic, this new training format offered by the QPR Institute prior to the Agricultural Community QPR for Farmers and Farm Families, which we engage them in, that QPR training is given online now with a master trainer, which offered some additional role playing for our trainers. So now they're better equipped to kind of lead participants through that role playing using QPR, and specifically in regards to questioning that individual as to whether or not they're in crisis, which we know based on this our preliminary findings of the pre-training data of willingness to intervene data was an area that they did not feel as confident in. So next steps, we're currently conducting ROSH analyses to examine pre and post training data, specifically the impact of training, as well as the differences in impact across these demographic groups. And in addition, we're also working to develop a scale to measure comfort, specifically for suicide prevention gatekeepers, as the issue of comfort related not only to presenting in general, but on presenting on suicide prevention has come up in our evaluations and in conversation with the research team. So specifically, we would like to conceptualize gatekeeper comfort so we can enhance our trainings to address that variable specifically, but also to determine how trainings can be led to help facilitate greater growth in gatekeeper comfort. And so finally, we want to thank our funders, CARIC, AgriSafe, and the Kentucky General Fund Appropriation in fiscal years 2020 through 2021. Thank you so much.
Hi, everyone. My name is Devin Charlier. I'm an evaluation student at the Upper Midwest Agricultural Safety and Health Center, and I'm here with my colleague, Megan.
Hi, I'm Megan Shasso, and I am the Director of Outreach and Center Coordinator at the Upper Midwest Agricultural Safety and Health Center, or UMASH. And we are one of 11 centers of excellence in agricultural disease injury, research, education, and prevention funded by NISASH, or the National Institute of Occupational Safety and Health.
Today, we'll be talking about a UMASH mental health partnership with NAMI Minnesota, a nonprofit organization dedicated to improving the lives of children and adults with mental illnesses and their families. They set out to normalize stress and poor mental health and train community members on key warning signs and interventions in the counties with the highest suicide rates and ag communities in Minnesota.
So we'll talk a little bit about how we got here. In 2017, there were a number of events that led up to UMass getting engaged in this work, including having a forum out in ag country that was supposed to be about health and safety that really ended up focusing on suicide in agricultural communities, and some really significant media and press coverage. This led to a UMass forum in 2018 where we gathered diverse stakeholders to generate ideas and build partnerships. NAMI Minnesota was one of the partners and stakeholders in the room, and they saw themselves in the work that needed to be done, which is where this project came out of. In 2019, NAMI Minnesota and UMash worked to build relationships, and they were able to train 300 participants and facilitate QPR trainings in several parts of the state of Minnesota. In 2020, NAMI Minnesota held 30 QPR trainings in person and online, and 2 mental health first aid classes, which reached over 800 people. NAMI Minnesota's UMash partnership, like Devin said, aimed to normalize stress and poor mental health, and they wanted to change the misconception in ag communities as being a sign of weakness. Using QPR, which is question, persuade, refer, and evidence-based training to prevent suicide, they were able to equip community members with knowledge and skills to identify warning signs, increase help seeking, and respond to mental health crises. The program was a unique model where they trained community members to train their communities, so ag community members for the ag community. Participants in the program reported things like improvements in awareness, skills, and preparedness. And additionally, this has become a priority population for the state of Minnesota. And as we mentioned here, Haley from NAMI Minnesota observed that there was such a sense of community in the room. You could feel the isolation breaking down.
So as Megan said, partnerships were key to NAMI Minnesota's success, and they really leveraged those partnerships to meet their goals and objectives, and really highlighted that relationship building was important to understanding the unique needs of the communities that they were hoping to serve. So our initial partnership with UMash and NAMI Minnesota really facilitated connections with other key stakeholders. Some are pictured here. For example, NAMI Minnesota connected with their local NAMI affiliates, which was really helpful because local organizations know their unique communities and how best to reach their members. Another example is that in 2018 to 2019, a partnership with Land O'Lakes led to successfully training 240 individuals in QPR, which allowed the overall program's capacity to exponentially increase as each trained community member was able to teach additional classes. And then in 2020, NAMI Minnesota participated in our virtual UMash Expo, which reached over 700 people with mental health and stress resources, including their QPR trainings. And these relationships also allowed NAMI Minnesota and others representing specifically ag communities to really have a seat at the table at statewide coalitions and task forces on mental health. We found that NAMI Minnesota, as they pivoted in COVID-19 from an in-person to online setting, this was really important because it was addressing the increased need for suicide response and connection building as new stressors were arising for the farming community. And both settings were successful in different ways. So in person, a sense of community was built as many people knew the presenter, and the presenter led with both content knowledge and relevant lived experiences about suicide prevention. And support systems developed organically, feelings of isolation decreased, and many participants followed up with presenters and others after the session concluded. Online, more people were able to attend from many areas of the state. Participants were more comfortable as it was less intimidating to tune in from the safety of their own home. And these sessions still successfully built a sense of community, but in a more expansive way, as people could connect with others all over the state going through similar stressors. So overall, we've been really excited about the success of this partner program and its impact in Minnesota. We feel that the model where the program is really led by ag community members for their own ag communities is one that worked really well for mental health in this population, but it certainly could be replicated in other topic areas in ag health and safety. Thank you so much. We look forward to your questions. You can reach out to us, and thank you to our partners from NAMI Minnesota.
This study focuses on the programmatic and individual factors influencing the quality of life of farmers with disabilities. Farmers experience a high rate of injury and disability due to agricultural accidents. A lot of those injuries are work-related, they're related to farming. To address this, the USDA, the United States Department of Agriculture, and NIFA, National Institute on Food and Agriculture, have developed the AgriAbility Project. One of the important goals of this project is to enhance and protect the quality of life of farmers and to ensure that they can continue farming in production agriculture. The main purpose of this study is to explore and understand the programmatic and personal factors that contribute to significant changes in quantitative scores of farmers on two main scales. One is the quality of life scale, and then the independent living and working scale. Farmers who were past clients. Phone interviews were conducted with 9 past clients of the project who had either the highest or the lowest combined change scores on quality of life or as well as independent living and working measures. Semi-structured interviews were conducted. Data analysis was done using a grounded theory approach. Key factors that determined who improved the most in the project include perceived social support from the project, assistive technology and other supports from vocational rehabilitation, clients' intrinsic mastery motivation, as well as family support. So the perceived family support, social support from the project played a very important role in determining who benefited most from the project. The project staff do a comprehensive assessment on the farm where they observe the farmers doing their daily farm tasks, and based on the observation, they give recommendations and information and resources related to assistive technology modifications so that the farmers can do those things in a more safer as well as more effective manner. What was also important was the communication and the relationship between the staff and the client. Over time, they developed a relationship based on trust. There was timely follow-up from the project staff as well as the rehabilitation agency. A lot of past research has linked perceived social support to improved management of chronic health conditions, reduced stress, and improved mental health for the clients. As we all know that farming is not just a vocation, but it's a way of life. So when clients are able to accomplish their farm tasks in spite of their age and their limitations, it gives them a sense of meaning and engagement, and that makes them feel assistive technology and other supports. Another big factor was the tangible benefits that the clients receive from the project. A lot of them were monetary benefits, ranging from $1,000 to $45,000, but they were in the form of equipment or modifications, including steps or bars or things like that that made tasks easier for the farmers. Intrinsic mastery motivation of clients was another important factor. Clients who had a high intrinsic mastery motivation were more likely to benefit from the project, which is in line with past research. They were more likely to, more motivated to implement and to proactively initiate the assistive technology recommendations that were made by the project staff. Family support was another important factor that played a big role. Farmers who had families who were more supportive and were on board with the project were more likely to give more time, resources, and be more engaged with the project. Conversely, clients who benefited the least had communication gaps with the project staff, had delay in obtaining VR services. They also noted other technological barriers and other barriers that prevented them from benefiting the most from the project.
Hi, my name is Julia Bai. Today I'll be presenting my presentation titled Stress as a Risk Factor for Farm Injuries in the Central United States by Julia Bai, Cheryl Bessler, Risto Rautianen, and Lorena Baccaglini. Sources of stress among agricultural workers could be economically, politically, environmentally, and socially induced. Some examples including climate change, reduction in product yield, and changes in policy. Additionally, dangers related to farming and ranching, such as contact with heavy machinery and livestock, working alone, exposure to harmful chemicals and movements, and distance to a healthcare provider can also lead to limited workability during recovery, which can then lead to financial burden and additional stress. However, little is known about the number of injuries and its relationship with perceived stress. The objective of this cross-sectional study was to evaluate the association between self-perceived stress and the number of injuries among farmers in the central United States, taking other potential risk factors into account. The Central United States Center for Agricultural Safety and Health, aka CSCASH, from the University of Nebraska Medical Center, administers surveys to a stratified random sample of operations within 7 of the central states in the U.S. 2,500 operations within each state received surveys in 2018 and 2020 regarding injury, illness, exposure, and personal protective equipment use by the operators in each responding operation. There was a total of 5,428 responding operations, and after cleaning the data, our final data set contains 6,744 operators. The exposure variable was whether the operator had reported a work-related high stress level during the past 12 months, and the outcome variable was the number of injuries. We ran a Poisson regression model on the demographic factors associated with injury among all respondents, and work time was included as a class variable during the variable selection process to simulate work effort value. The demographic results of all respondents is shown in Table 1. The respondents were predominantly male farmers or ranchers and reported their work time as 100% spent at the farm or ranch. Additionally, the majority of respondents are older than 55 years old. Figures 2 through 4 show demographic characteristics of respondents with injury that responded to all the questions pertaining to their injury. Figures 2 and 3 show the dispersion of estimated costs paid by self or an insurance company of the primary injury suffered by the operator. The primary injury is defined as the most serious injuries suffered by each operator. The most common location where the injuries occurred is in the farmyard or field or pasture. The most common cause of injury includes livestock, ground floor surface, or machinery. Figure 5 shows the amount of lost work time due to primary injury. The majority of respondents did not lose work time due to injury. However, 14% lost a month's worth of work time due to their primary injury. Figure 6 shows the adjusted Poisson regression model of statistically significant factors associated with injury among respondents. The prevalence ratio for injury increases significantly if the individual has experienced work stress, have adults living in the operation, experienced hearing loss, experienced musculoskeletal pain, or produces wheat. Prevalence ratio increases the most among those who have experienced pain or discomfort in the musculoskeletal area. We are unsure of why wheat production is a risk factor for injury. However, its effect size is the smallest compared to the other risk factors. Additionally, during the crude analysis, we identified wearing personal protective equipment as a good indicator for injury risk. Finally, Figure 7 shows the trend of work strain symptoms among all respondents. We identified a strong upwards trend for high stress level, exhaustion, and sleep deprivation in relation to the increase in the number of injuries experienced by the operator. So what are some of the main takeaways from the results? Well, high perceived stress increases the prevalence ratio for injury, as does having musculoskeletal pain, producing wheat, hearing loss, and having adults living on the operation. An increase in work strain symptoms such as stress, exhaustion, and sleep deprivation are associated with an increase in the number of injuries. Future studies focusing on sector-specific causes of stress and injury would be essential in strategizing interventions and correlating prevention resources for those affected. Based on our observations, injuries could be reduced by focusing on changes in farming and work practices that reduce stress, sleep deprivation, exhaustion, and musculoskeletal strain. Thank you so much for listening to my presentation. If anybody have any questions, please feel free to contact me at julia.by@unmc.edu. Thank you. Have a great day.
Hi, my name is Praset Kamai. I am a PhD student from University of Alabama at Birmingham, School of Nursing. The study I'm going to present today is association between psychological distress and COPD symptoms in farmers. Farmers are exposed to various kinds of factors that can cause COPD and induce COPD symptoms for those who already have COPD. It is also reported that the prevalence of psychological distress in farmers is higher than in general population. Furthermore, the previous study have revealed the association between increased COPD symptoms and psychological distress. The reason behind this association is that psychological distress can impair the immune system and contribute to infection and airway constriction. However, the association between symptoms of COPD and psychological distress in farmers had not been well explored yet, so it is important to understand the association between these two variables to decrease the risk of COPD and psychological distress in farmers. The purpose of this study is to examine the association between COPD symptoms and psychological distress in farmers after controlling for other known factors associated with COPD. This study is a secondary data analysis. We used the data from the Behavioral Risk Factor Surveillance System from 2017. The population of this study is farmer. We identify farmers by using a question about physical activity in this survey. The respondents who reported farm or lunch work as their physical activity in the most time during the past month were identified as farmers. The primary outcome variables of this study are COPD symptoms and psychological distress. Besides these two variables, we also analyze age, smoking, general health status, and income as control variables. In this study, we used chi-square t-test to assess the difference of demographic data between the participants who had COPD symptoms and those who did not have COPD symptoms. To assess the association between psychological distress and other variables, we use both simple and multiple linear logistic regression. Initially, we found that among 240 identified farmers, 45% of them had psychological distress, and 31% of them had at least one COPD symptom. We also found the significant association between COPD symptoms and psychological distress from both simple linear logistic regression and multiple linear logistic regression. The simple linear logistic regression suggested that the odds of COPD symptom occurrence for the subjects with psychological distress was 2 times the odds for those without psychological distress. When we used multiple linear logistic regression and control for age, smoking, and general health status, it still suggested that the odds of COPD symptom occurrence for the subject with psychological distress was 2 times the odds for those without psychological distress. The result of this study suggests that farmers with psychological distress may have increased COPD symptoms, which is consistent with prior studies. However, the effect of psychological distress on COPD symptoms is not ensured, as the association between these two variables can be directional. Further, longitudinal studies are needed to determine the causation of psychological distress on COPD symptoms.
Hi, I am Megan Chasso. I am the Outreach Director and Center Coordinator for the Upper Midwest Agricultural Safety and Health Center, or UMASH. And today I'm going to be talking about our Aging on the Farm work and the model that we've been using to respond to emerging issues, and then specifically talk a little bit about 4 partner projects that have been working to stimulate safe and healthy aging in agriculture. So first, a bit of how we got here. As an organization, we wanted to understand how, as a community, can we support the health and safety of aging farmers and farm families. There are a number of unique pieces of farming where you may live and work in the same place and be exposed to a large number of hazards. And that can really make one think about how we age healthily. So we decided to convene a group of stakeholders, from health professionals to farmers themselves and all of their support networks in between, to talk about how we might facilitate some of this work. So first we asked, what are the concerns? And we used a wiki survey to do this. And here we can see the top 4. And this really just helped us think about who we wanted to have involved in this process and how we might approach this community-based work. These community forums happened over Zoom in 2020, the year of Zoom. And so the community forum looked just like this. And following our community forums, we were able to fund 4 partner projects where we've been working to support a number of different groups in doing innovative projects that are typically replicable. And that's where I'll spend the remainder of my time. So first, our Parkinson's disease project. This one's called Active at Home. It's a partnership between the American Parkinson's Disease Association of Wisconsin and the University of Wisconsin. And the goal of this is to support the health and wellness of those diagnosed with Parkinson's disease in the upper Midwest, rural and agricultural communities, by creating these expert design toolkits that support in-home activity, along with a replicable client-centered experience where folks talk to UWOTs. And all of this is meant to help improve physical and mental well-being, which is measured through self-assessment surveys. We're also working to support Alzheimer's dementia community caregivers. So the goal of this is to assist older farmers remain in the community and on the farmstead and be active in their normal lives for as long and safely as possible. And this work is being done through 3 focus groups. So one is training rural physicians. So not all the times, but sometimes rural physicians are not able to specialize as much. So this fills in that training and education piece. We're also engaging with communities on understanding memory loss and what does it mean for businesses and what does it mean for farmers, individuals. And then finally supporting those caregivers, particularly those on farmsteads, through things like memory cafes and memory kits, which are now available at local libraries, thanks to this project. We're all more healthcare training for professionals to support the care of aging farmers. This is another occupational therapy project. So the goal was to increase agricultural community access to occupational therapy or OT services and information to really facilitate aging in place across the upper Midwest region by engaging in OT educational programs. So the University of Minnesota OT students are involved in this. What they're doing is they're developing and providing an OT telehealth practice, and they're also creating and delivering a series of webinars that talk about strategies for aging in place safely and healthily that can also be accessed on demand. And finally, we have a project focused on closing the gaps between the needs of aging farmers and resources that already exist by leveraging the community and partnership in faith-based communities. So this project aims to improve the quality of life and health outcomes of aging farmers by forming partnership in this ag communities, these rural communities. They're identifying barriers to accessing services and resources. They're identifying the best way to get that information back into the community, and then they're sharing all of that back with their communities. So through UMash and to other community-based organizations that can benefit. And that is where I will close, and I thank you for your time and look forward to discussing this work.
Hi, my name is Shelby Powell. I'm the Outreach Education Coordinator at the Southwest Center for Agricultural Health, Injury Prevention, and Education. Today we want to talk about our Seasons Change, You Remain Mental Health Social Media Toolkit. Now what this is a way to promote mental health resources for the agriculture community. We also want to reduce stigma around mental health and all that it implies as most producers think about what mental health is. And lastly, we want to cultivate healthy workers. And we think that starts with creating conversations and allowing workers to feel understood and heard, and also know that what they want to talk about and the things that they feel are okay to discuss with peers or even professionals. And we did this by creating a social media toolkit that they could see online. So it's going to be promoted to producers through Facebook and Instagram, Twitter, and we would like other organizations to promote these messages as well. So today's agenda, we're going to discuss what this media toolkit does, the AFF population being agriculture, forestry, and fishing, and their mental health, reducing stigma around mental health messages and thoughts, and as well as talking about the social media messages we created, and conclude. So the goal of our session today is really to discuss the increasing need for mental health resources in the agriculture, forestry, and commercial fishing sectors. And we want to look at how the Southwest Ag Center is using their social media messages to reduce this stigma. So again, with the AFF population and mental health, understanding their increasing need for rural-specific mental health resources is important. Now we need to understand a few things about mental health in this population. Many factors that affect this population, again, are largely beyond the control of the producer. Some of these things include financials, market prices, weather, and other conditions that affect their harvest and crop. So it's important to know that they're not always in control of the things that happen to them that create this large amount of stress. So we also want to promote that, again, though these stressors are not always easily removed or can be removed at all, one's level of stress and how it affects their life can be managed. So according to the National Institute of Mental Health Disorders, an estimated 26% of adults suffer from some form of mental health, and that does include the AFF population. And it's important to know that this group, they do not often seek out available resources, and that can be due to a few different factors, and some being privacy concerns, the stigma that's involved around mental health, cost, financial resources, and if it's even available in their area. So they might have to travel quite a bit to get there, and so it takes a lot of work to set up the appointment and to follow through with that care. So lastly, we believe clinicians and hotline personnel need to understand the rural-specific stressors that affect the AFF population, really in order to provide the most comprehensive and complete care that they need. So the social media messages we created, again, to cultivate messages that reduce stigma. So what we did was we used messaging that sounded like this. Farm stress means managing stress, not ignoring it. You can't keep going if you're running on empty. And do you worry what you do isn't enough? These are kind of internal thoughts, internal dialogue that the producers might have with themselves or maybe with others. And so we wanted to use messages that related to them, and we wanted to reinforce the idea that it's okay to ask for help. So everyone, even farmers, ranchers, and those in agriculture, they do need a break sometimes. And although they're very strong, resilient workers and people, and the culture is one of strength and independence, that does not mean that they can't ask for help when they're struggling. Their ability to recognize and manage stress is a strength. So the more agricultural workers can see these types of messages, the closer we get to reducing stigma around mental health. These are some of the messages that we created, again, using that internal conversation or common dialogue and speech that they would have. And again, we wanted to use a very diverse group of individuals that would represent all cultures and backgrounds. Thank you.
Hi, I'm Matthew Pills, Programmer Analyst for National Farm Medicine Center. In this video, I'll give you a high-level overview of CASN's efforts toward a modern online community. Prior to this initiative, the Child Agricultural Safety Network relied on traditional listserv-style communications. That approach provided limited one-way correspondence through a simple email list, maintained and disseminated by a single individual. As CASN continued to grow, it became more difficult to upkeep the subscriber directory, and distribution of topical news and information became strained. To modernize the CASN network, we began researching online community platforms. Unlike the traditional single point of contact approach, online communities promote real-time discussions, announcements, and member-to-member collaborations to create a much more dynamic and engaging presence. Baseline criteria taken into consideration during our evaluation phase included the ease of deployment and maintenance, the versatility of feature sets and options, and the affordability, especially for nonprofits. The goal was to facilitate easier conversations and incentivize new discussions and memberships. 4 popular external services were reviewed, including Higher Logic, HiveBright, Mighty Networks, and Tribe. With CASN's use cases in mind, we sought a platform that would support topic-based hierarchies, event listing management, personalizable notifications, and future expansion capabilities. After careful analysis based on our needs and resources, Mighty Networks was chosen for its flexible tier-based subscription model, familiar Facebook-like interface, easy deployment, and well-rounded feature set. Mighty Networks offers 3 plans for its users. CASN opted to enroll in the business plan to accommodate online courses, including some planned safety and health workshops, tie-ins with third-party libraries including advanced analytics, unlimited file and photo storage, and other premium benefits. From a technical perspective, Mighty Networks provided convenience in our transition towards an online community. We were able to utilize one of our previously established domain names for a simple and familiar access point using desktop or mobile devices. Since the infrastructure is hosted and maintained by a dedicated team of experts at Mighty Networks, it did not place undue burden on our internal workforce and alleviated in-house server upkeep responsibilities. Users who are invited and approved will find the registration and sign-in process very straightforward. Mighty Networks also supports optional sign-in authentication through Google, Facebook, LinkedIn, or Apple. After signing in, you'll be taken to the CASN Online Community social feed. This webpage is very similar to other social networking platforms. In fact, ISASH itself also uses the Mighty Networks platform for their online community. As with any social networking platform, the homepage allows you to quickly share what's on your mind by creating a new topic or post, sharing multimedia, or otherwise contributing to the existing conversations. You can see featured content, upcoming events, and other posts by other users, which you can again click into to review that in more depth or cheer them on by reacting and adding commentary below. The left sidebar menu can be used to quickly access different sections of the community and filter content to your liking. For instance, the topics page. Each post created to the CASN community can be assigned a specific topic for better organization and future filtering uses. To get started, CASN has come up with 5 different topics that we believe will capture a wide array of discussions within our community. General members will be able to add topics of child egg incidents, news and announcements, or child egg safety resources. Hosts and moderators have control over the CASN campaigns and CASN meetings, where we will house various materials specific to CASN and cultivate safety. To drill down into any of these topics, you can simply click to review the content. For example, the CASN campaigns topic area houses all of our posts and announcements about past and present campaign actions. You can click into each one to review additional high-level overview information, or drill down more specifically using the companion website, which links to our cultivatesafety.org website to that specific campaign, where you can then scroll through and access additional material as needed. At the time of this recording, CASN's migration to an online community is in the final stages of a soft launch. We anticipate more findings and conclusions after the community has matured. Thank you for watching, and please reach out with any questions you may have.